for those of you that follow my trigeminal journey that you've seen me, I had MVD surgery in March of 2014, so we're just passing the 2-year point. And so I just thought I should put an update, because the last update I had was June following that surgery, and oftentimes people want to know, well, long term, how do people do with that? You know, how did it work? How does it work? So I'm here to tell you that I had it done on this side, on the left side of my face, and yes, it worked. It was a success for me. On this side, I would much rather have the little things that I have, little tweaks, than having the trigeminal pain. I mean, oh my God. So before I go on to telling you about my other side, I just want to update you on the side that had the surgery 2 years ago. So probably the last couple of months, I've noticed I've been getting a lot of like funny kind of pain just around where the Teflon plate is in my head, and I know it's exactly that spot. It's a very strange, weird feeling. It just kind of throbs and aches, and I'm not sure. So I spoke to a friend of mine who's actually a neurosurgeon resident, and he said, remember, Monica, when I told you to keep massaging that area, you have to keep breaking up the scar tissue, and as it heals and heals, of course, more scar tissue gets there. So, you know, he's absolutely correct. So I've been massaging it, and like it hurts. See, it kind of hurts to rub it, but it's one of those hurts that kind of feels good when you're rubbing it, like I'm massaging it right now. And for the longest time, for those of you that are about to have your surgery, or those of you who've just had it, down the way as you heal, it kind of dents your head in that area, dents in. I can't describe it, but it kind of feels kind of creepy. Like, it made me feel queasy at first when I go to wash my hair and there'd be this little dent there. But that is about the time, that's why I stopped massaging it, because I didn't like the feeling. Even when I wash my hair, I kind of avoid that area. But now I've got to learn to accept my new head the way it is, and nothing's going to happen if I massage firmly on that area. It's all going to be fine, and it is fine, and it really does reduce that, I don't even want to say pain, discomfort, I guess. So I would say I'm 100% cured on that side. It's been over 2 years, and so far so good. Thank you, God. Thank you, Dr. Finley. Thank you, Trigeminal Neuralgia community, because it's pretty much gone. I get the odd TN pain, just so mild. When you think that you were living with pain that was 12 out of 10, when I say get the odd pain, it's like about a 2 out of 10. So you know what I mean? You can function. I don't know where to look on this. Is my iPad. I think the camera's there, so I'm probably going to be looking there. I don't know. So I apologize for that. It has nothing to do with brain pain or brain damage or craziness, you know? So anyway, I'm sitting in my bed right now, so I'm going to flip over to the other side. I'm one of those super lucky people that was blessed to have trigeminal neuralgia show up on this side now. Exactly the same thing. This summer I had an MRI, and they were doing an MRI because I was getting that radiculopathy pain in my arm that was horrendous. And I have to say that pain is pretty equal to the trigeminal neuralgia pain. Nerve pain is horrible. I don't care what it's caused from. Let's just put that out there. If anybody's having nerve pain, God bless you. It is horrendous. It just feels so awful. It's just, it makes you nauseous. It's horrible. So I was having that pain in my arm, and so they needed to do, I also had a really bad episode last October with trigeminal pain on this side. I had to go to the hospital. They did a dilantin infusion and all the same things that they did on this side. And yes, it was confirmed you have TN on that side, but they wanted to do an MRI just to be certain. So to make a long story short, I was getting an MRI on my spine because of my arm. So they decided to do the head and neck and the spine at the same time, both MRIs at the same time. And that was as uncomfortable as it was. I was so glad that they did it. So the radiculopathy pain has settled down. It just kind of settled down on its own. And then the TN pain, they started me back on Tegretol. I was off all meds after this surgery on this side. And then they decided to reintroduce carbamazepine or Tegretol, whatever you call it in your country, on the right side. The pain on the right side without any drugs in my system was 100 times worse than the worst pain I thought on this side. So that's how I knew it's TN pain, but I'm like, it's pretty rare to have it on both sides. Some doctors don't even believe that you can. But as it turns out, I went to the emergency. The emergency doctor pulled my file up. He was fantastic. He had never seen anyone with TN, but he read what they had done at the university hospital when I came in for the pain. He did it exactly the same. He treated my pain. Oh, I just thought he was wonderful. And he sent the file, the emergency file, on to my neurosurgeon. My neurosurgeon had just done a worldwide tour lecture on people with bilateral trigeminal neuralgia. So as soon as he saw it, he called me in, which was kind of funny. I didn't expect to even hear from him. He called me in. So that's why I got the MRI right away. And then he called me in and he said, yes, you have an artery leaning. He said, it's almost mirrored to this side, even though the brain works independently. Each side works independently of the other. So just because you have it on one side doesn't mean you're going to get it on the other side. It's already rare to have it on the one side, so if you have it on the other side as well, just consider yourself lucky. Yay for me. So the Tegretol was working really, really well. All summer long, because once the arm pain went, I had no pain in my face at all. He asked me if he wanted to go ahead and do the surgery right away on this side, but I said no. I'm not experiencing any pain whatsoever. The Tegretol is just managing it great, and so I was so pleased with that. And then in the past about, I want to say, week, I had one bout of where a cold drink triggered the pain again. And I was like, that's kind of weird. And so anything, if I go into exactly the same triggers I had on my left side, if I go into like the freezer section of a store, that cold temperature change, it will trigger it, and it did it again last night. Again, it wasn't that bad. It was about 7 out of 10, manageable with pain meds and heat and, you know, the usual. But it just kind of raised my eyebrows like, what's going on? So then last night, I was completely fine. And I went to have a drink of water, and it went from 0 to 1,000. It was horrible, absolutely horrible on this side of my face. I was rocking, moaning. I didn't know what to do. It was just horrible, horrible. So I got heat and took my, you have to focus and try to calm down and try to relax yourself and do the things that you remember that really worked the first. You cannot give in to that pain. That's all I can say. You just have to rise above it as hard as it seems, even to get up, to get a glass of water, or just to, anything. Rise above the pain. So I took the medication I needed, and then I put heat on my face, and then I found just laying on this side and just watching TV for some distraction because the pain meds had kicked in a little bit, and then I just fell asleep and I was okay. So I had to get up this morning and go for an ultrasound on my stomach. My stomach's been bothering me a lot. It's probably from all these medications. And so then I came back home, and so I'm a little tired, so I'm going to rest a little bit right now, because I really think rest is so key with these conditions, especially these nerve conditions. And I know the only way the brain can rejuvenate is by sleeping. So if I can snooze off for a little bit, it might help keep the pain down, So, so I just wanted to update you guys on my TN journey so far. Sometimes you think your journey's over, but I don't think it's ever over. You always have trigeminal neuralgia. It's just always there. It's just if we can manage as TN people to control our pain or get our pain controlled or hopefully reduced as much as it can be. That's the goal. And so I can say for sure the pain on my left side has been successfully reduced to a minimum. It's not even pain worth mentioning. It's like if I do get it, it's kind of like and then you go on to something else, but this one is red alert, firing. So at least I know I'm already, if I want surgery, I just have to call them. He said, you call me anytime when you're ready and we'll just book you in for surgery, and that's it. So that's all I have to do. I just don't know right now if mentally, I've been through a lot this year, a lot of emotional stuff, and I just don't think I can handle brain surgery right now. Like, it's not that it was the most difficult of things I've had done, but I just don't, I don't know. I don't want to have it right now. So hopefully this side just triggered just random for some weird reason, and maybe I can hold off till the summertime. I see my neurologist in July, and then I won't have to call the neurosurgeon, so I'll just keep my fingers crossed. You just go day by day. And I'm just thinking about all of you people out there with trigeminal neuralgia. If you have any questions about the surgery, about anything, just put it in the down bar. I even got my hair cut since my surgery, because my hair was long when I had my surgery, and you can't, I'll show you. The scar is so minimal. I mean, I could feel it, but I don't know that you can really see anything back there. I don't think so. It's right there, right along. That's where it dips in and feels creepy to me. It just gives me the heebie-jeebies, but that's just me. So yeah, it's like you can still wear your hair short, long, whatever you want, and you get back to your life, and it's such a nice feeling to have some normalcy with pain not in your life, So that's my wish for all you guys. So if you have any questions about trigeminal neuralgia, about the surgery, or about bilateral trigeminal neuralgia, just leave them in the questions in the down bar, and I'll help you as much as I can. And I'll be back, who knows when, in a few months with another update. Bye.